project on brucellosis. I am Kevin. Brucellosis is a widespread zoonosis mainly transmitted from cattle, sheep, goats, pigs, and camels through direct contact with blood, placenta, fetuses or uterine secretions, or through consumption of contaminated raw animal products, especially unpasteurized milk and soft cheese. In endemic areas, human brucellosis has serious public health consequences. Causative agents. Worldwide, Brucella melitensis is the most prevalent species causing human brucellosis, owing in part to difficulties in immunizing free-ranging goats and sheep. Other species include 1. Brucella abortus, 2. Brucella melitensis, 3. Brucella suis, 4. Brucella canis. Brucella suis biovariant 2 and Brucella maris infections have rarely been described. Transmission. As stated earlier, brucellosis is a widespread zoonosis mainly transmitted from cattle, sheep, goats, pigs, and camels through direct contact with blood, placenta, fetuses or uterine secretions, or through consumption of contaminated raw animal products, especially unpasteurized milk and soft cheese. Infected animals, mainly cattle, sheep, goats, pigs, and less commonly dogs and other animals, and their products are the reservoirs and sources of infection. Ingestion, direct contact through breaks in the skin and airborne infection, laboratories and abattoirs, primarily affecting consumers of raw milk and derivatives, farmers, butchers, veterinarians, and laboratory personnel. Incubation period. This is the time taken for clinical manifestation of the disease to occur following infection. The incubation period is highly variable, usually 2 to 4 weeks, can be 1 week to 2 months or even longer. Diagnosis. Presumptive diagnosis done through 1. Rose Bengal test, also called RBT, for screening. 2. Standard agglutination test, SAT. Confirmatory diagnosis is done through either of these. 1. Isolation of Brucella species from blood or other clinical specimen. 2. A presumptive laboratory diagnosis based on detection of agglutinating antibodies, RBT, SAT, combined with detection of non-agglutinating antibodies through A. ELISA IgG test, B. Coombs IgG. PCR and new rapid tests such as the lateral flow assay are yet to be accredited. Clinical presentations. Clinical description. Brucellosis may present with acute or insidious onset, with continued, intermittent or irregular fever of variable duration, profuse sweating, fatigue, anorexia, weight loss, headache, arthralgia and generalized aching. Abscess formation is a rare complication. Brucella endocarditis and neurobrucellosis cause most deaths. Prevention and control. In countries where eradication in animals, through vaccination and or elimination of infected animals, is not feasible, prevention of human infection is primarily based on raising awareness, food safety measures, occupational hygiene, and laboratory safety. In most countries, brucellosis is a notifiable disease. These methods can help prevent brucellosis. Education to avoid consuming unpasteurized milk and milk derivatives. Barrier precautions for hunters and professionals at risk, butchers, farmers, slaughterers, veterinarians. Careful handling and disposal of afterbirths, especially in cases of abortion. Serological or other testing of animals, immunization of herds or flocks may be envisaged. Eliminate infected herds or flocks. The most successful method for prevention and control of brucellosis in animals is vaccination. Control activities to be coordinated and shared between the public health and animal health sectors, who should ensure joint administrative arrangements to facilitate immediate cross-notification of cases, as well as coordination of joint investigations, control, and public health education programs. Thank you for listening.